Welcome to the On Call for Men's Health podcast, and I'm Dr. Michael Lutz. This is where we talk about things you don't want to talk about, but these are conversations that could save your life or the lives of the men you love. Thank you for joining us, and today we're going to talk with Dr. Michael Rovito. Dr. Rovito is an associate professor of health sciences at the University of Central Florida and the founder of the Male Wellness Collective. I've known Michael for many years, and we've worked together actually professionally through our foundation and through his as well. He's a testicular cancer researcher, and part of that is going to be the focus of today's discussion. He's also has a PhD in public health, and he's also a certified health education specialist. Now I know what CHES finally stands for. Thank you. But what I love most about Michael is that he's a men's health advocate, just like me. And that's where we share our passion and our commitment to our community. And this is what we're going to talk about today. So, Michael, thanks for joining us.
Oh, thanks for the invitation. It's fantastic to speak with you again and talk turkey. I love it. Thank you.
So we will talk turkey. We're going to talk about a lot of turkeys, but only men's health turkeys today. And I'm just kind of curious, Michael, why do you refer to it as the Male Wellness Collective?
It's a good question. We chose Male Wellness Collective because we wanted boys to feel included when we talk about stuff. And so we chose the word male, and instead of health, we're using the word wellness. We saw wellness as being more of a well-rounded kind of like conversational or just idea behind like the human body. It's like, yeah, it's physical health and it's mental health and it's psychological, but then we're getting into spirituality, wellness. And so we're like all these dimensions of wellness that are now being spoken of in the literature. I was like, wow, that could be a really great word to use instead of health. It's just a bit more expansive terminology for how we operate. But again, when I say this, there's no knock against any other use of the words men's health anywhere. We are just choosing our words male wellness. And then collective, it's not just a one person or two person show. Literally, it's like when we work with someone like yourself or others across the country, it's like-minded individuals that are working together as a collective. And that's how we're kind of viewing all of our programs and discussions and papers and whatever. It's just a collective of people that's writing or doing as a, just interested group. And so that's why we chose the word collective. And so when we rebranded from Men's Health Initiative to Male Wellness Collective, it was more than just a name. It was a feel. It was palpable for how we conducted ourselves. And so I'm sorry for a really long, jargony kind of explanation for that, but
I like it. Well, that's why you got your PhD.
That's right. That's right.
So, it's interesting. For 10 years, we've worked together on our Fight Like a Man International Collaborate, which is a collective of individuals all across the world who are like us, who care about men's health and advocate for men's health and like to share their stories of the health of their communities. And one of the people who I've adored over the last number of years is Dr. Larry Goldenberg from the Canadian Men's Health Foundation, who once spoke about a spoke and hub phenomenon for men's health. In other words, there should be a hub. There should be a central organization that actually kind of like chairs this whole advocacy movement for men's health, and all of us serve as spokes on that same wheel. The problem is finding the hub. I know we're not the hub. I don't know whether you feel you're the hub, but one day we will find that hub, and it's nice that we can all work together and do something for the community. I noticed that on your collective, your wife, Kathy, is intimately involved. So how does she play a role in this, and how is that part of your life in addition to being married to someone who you love dearly?
I'm not just saying it because it's good radio or whatever. If it wasn't for her, I don't think it would exist. And this is truth be told, like if it wasn't for her, I don't think I'd be here. I had issues with suicide tendencies and stuff when I was younger, and just for the traumatic experiences that I've been through. And it was like when I met Kathy, like it was like a metamorphosis of like mind, body, and spirit. And so she literally was like a saving angel, like a saving grace kind of like guardian angel thing for me. And besides that little after school special, she got me into the mindset of the name switch, and she was a catalyst for me for that health education kind of spin, the wellness spin. She's a 30,000 foot thinker, but very, very detail oriented, if that makes any sense. And so she is a CEO. She runs the show. I'm just a talking head. Like I have ideas and I like to execute papers and collaborations and stuff, like I'm more action oriented. She's more of like the brains behind it all. She's like the Wizard of Oz, and I'm like the hologram. She's the person behind the curtain, if you want to put it that way. And so
Well,
without her, it wouldn't exist. She pulls all the levers, and I'm just here to kind of say yes, ma'am.
well, thank God she's been pulling the right levers for you so that you're the person you are today.
Yeah, and that's honest God's truth. And like, I don't think I ever said it like that to her, but if it wasn't for her, this wouldn't exist. And that's why, not to do a little diatribe, but like a little offshoot. That's why I love having her as a CEO, because it just showcased that men's health is not just for men. It's for women and females too. There's a role for everybody here.
Oftentimes we have to have that discussion with people when we talk about men's health, that really men's health is about family health. It's about supporting each other. It's about women supporting the health of men, and men being healthy so that they can then help take care of the women in their lives. So everything is a give and take, and it's not just a one-way street. And it's all about being considerate and maintaining your health and wellness so that you can actually be a good caregiver for each other.
Oh, yeah.
And a lot of people forget or don't see that other side of the coin, so to speak. They think you talk about men's health, so therefore you're only talking about the health of the men in your community, and everybody else is without any respect or consideration.
Yeah, exactly.
You talked about wellness. One of the things I think would be interesting just to hear your thoughts on is that, we live in a healthcare system that's really not healthcare, it's sick care. And everybody addresses their healthcare through getting sick care. Men typically, more so than women, only seek out healthcare when they have a malady, an illness, feeling out of work or out of sync that's so bad that they can't exist. It's not something for prevention. Do you think we'll ever change from a sick care system to a well care system? And how do you think that transition could occur?
Man, if I had the answer to that question. We just did Journal Club. At UCF, where I teach, I have the Testicular Cancer Research Collaborative, and we just had Journal Club. And the article that we just critiqued was from Urologic Oncology. It was talking about urologic cancers and how the pandemic had a potential impact upon treatment deferrals. And the topic come up, it was about insurance and delays and this and that and about deductibles. I'm like, my God, how do we get to this point? Like, it's just so crazy that people like what this survivor was on. He's like, yeah, he was a student and he had bilateral at the same time. What's that 0.005% of it? Testis cancer is like really, really rare. And he said, yeah, I had to pay 20% out of pocket. I'm like, where'd you find that money from? He's like, I didn't. It's still a huge issue for me. And it just, I don't know. That's a really great question. And it just, besides the whole like men waiting to go get treated because of whatever barriers that exist, it could be systemic prejudice stuff, like, distrust. It could be a masculinity thing, which is socially kind of like reinforced that men are supposed to be like this provider, John Wayne kind of person, which is so outdated. Man, just if we can cure that, that could solve a lot of problems. But there's that issue, like the push factors, right? Like, guys don't want to go, and for whatever reason, why? It could be something really legitimate. Well, it's all legitimate, but it could be something really out of our control, like a systemically prejudicial system, or it could be something that we can control, like the perception of care. But there's also like those pull factors, like the actual system that we're involved with. Like, I don't know how to change that. I could work on the prejudice stuff. I could work on the masculinity stuff. I could help get guys there. But the pull factors, the actual service, I don't know how to change that. That seems like such a crazy knot to untangle. I don't even know where to begin. But I do think that we could start with being a bit more welcoming to males with how we provide care. But that is not an answer to your question, because I don't have one. But it's a very, very great question that I wish we would definitely tackle.
I once went to a meeting where they asked the individual who's the head of the American College of Obstetrics and Gynecology, who was at a men's health meeting, what can we do to get men engaged in healthcare? And they said, if only men had a cervix. And I thought, what are you talking about? Are you crazy? He said, well, because women have a cervix, because women do childbirth and child rearing in general, they're engaged in healthcare once they have their first period. And men, because they go from childhood to adulthood under the care of their mother, once they leave the care of their mother, they leave healthcare. They are not engaged. And so this gets me to my next topic, which has been near and dear to you forever and ever, is testicular self-examination, testicular cancer screening, because this is the age group where if we were to ever have the ultimate hook to engage men in screening and early detection and body awareness, would be to teach young men about the need for testicular self-examination, which would get them more engaged with their own bodies and health and understanding. So tell me about how this affected your life as a young adult male and how this engaged you.
When I was 16, I felt a lump on my testicle. Just, you're getting a shower and you're like, oh, what's that? That was weird. And it was big. I don't know if I didn't notice it before, but it was definitely something that I didn't feel normal. I didn't know what normal was though. And it bothered me for a while. I started feeling some pain, like a little acute pain, like here and there. I'm like, this is not normal. It's weird. I don't want to tell my mom or dad about it. Then this is going back to the mid 90s. There was no like this. I mean, what I had access to was, the Dewey Decimal System. And the only option I had was tell my parents. And that took a while for me to do. Socially constructed masculinity issues of like telling anybody about anything, let alone my genitals. And I actually did tell him because it was like terrible. I thought I was going to die. I had this whole like recurring mortality thing. So I didn't know what was going on. And I kept feeling this thing and it was painful. So they took me to the urologist and it was like literally like one of those like Wild West, like where the guy comes into town once a month. It's like, you got to book it on the Thursday he's in town. Because if not, you have to wait a month to get access. And so it was like in an old fire hall that the office was in. And we went in and the guy's like, you have something called a varicocele. I'm like, what the hell is that? It was a varicocele. It wasn't cancer. It was a varicocele and I got treated for it. But then it came back in 2008 and I had to get it again, the varicocelectomy. And I was like, man, this is like an issue and I don't know really what's going on with it. So I was like, I just want to keep checking, I keep feeling myself because I want to make sure it doesn't come back and this and that. And so I just got more and more involved with that, like my own health. And then I was like, well, if I'm this confused, I'm sure most other guys are confused. Not that I'm special, but I'm like a normal Joe. And so if I'm confused, I'm sure other people are really confused. And what helped me was palpating my testicles and just checking myself. And that was a tool to spur me into becoming more well. That's the correct conjugation of that. But I became healthier just mentally and physically because of me filling my testicles up randomly one day. It spurred me to kind of be on top of this stuff. And so, yeah, I'm a huge advocate for the testicular self-examination, TSE. It's a free, cheap tool that we can do to help guys get involved and get active with their health. And there are issues around that. I'm sure we're going to get into that a little bit, but I'm a huge advocate of it.
Here's the thing is, we were talking a little bit about how do we get guys involved in self-examination. So we started a campaign called Got Nuts Check 'em. And we thought this would be a great partnership with Germac Nuts, put it a little tongue in cheek and make it a little entertaining and humorous at the same time, but create awareness. What we did is we convinced a friend of ours who owns a series of beer trucks throughout southeastern Michigan. They put this logo on the back of their trucks, Got Nuts Check 'em, with a logo of a guy looking into his own pants, a cartoon character. The one thing they realize is that there's a lot of people who actually read the back of beer trucks. And the reason they discovered it is because they got more complaints than they've ever had, ever, since they put any campaign on the back of their trucks. And the reason is because the world we live in is still not ready for that kind of advocacy. So we have to spread the word in such a way that we engage people without either being frightening or controversial or in their face. And so it's a really tricky, narrow line path that we have to follow, but we have to work together. And one of the things was the U.S. Preventative Services Task Force. And that's part of what has been your mission over the past several years. The U.S. Preventative Services Task Force, when it comes to testicular self-examination, gave it a D rating. D, don't do it. Why would they ever use that kind of a rating for don't do it? They could have picked any other letter of the alphabet, but they had to pick D, which is absolutely an abysmal response and will be unhelpful totally for our young men of our country. What kind of mission can we do to make a change?
I feel like it's spitting in the wind sometimes, but the only thing is a collective voice. Just keep knocking at the door of the task force just to ask them just to review the evidence again. It's like one of those things. It's like everyone's doing it, like air quote privately, like you recommend it to your patients. I recommend it to people that I talk, like all my students. It just seems like everyone's recommending it, from public health to urologist to urologic whatever. But still, like officially, it's not recommended. And so it's like it's this weird dichotomy going on. And so I don't know if it takes a collective voice, like just to ask the task force for review. I don't know how to change that, because they always claim there's a recommendation and that's all it is, but it carries a lot of weight. The task force does. It carries a lot more weight than what they say it does. I believe, and don't quote me on this, but I believe like most medical malpractice, like they'll kind of bring in the task force recommendation. If the person's being sued, they're like, did you follow the task force? And if not, then, tisk, this is how we're going to get you, something along those lines. So it carries a lot of weight. So I don't know any way to get around that. We have to convince them somehow to kind of take this up again, to change this. I don't want to, belabor the point, but it is a hugely important issue to me to kind of get them to change this rating, because it's, part of my French, it's a bit absurd that if you looked exactly at what was going on, if you looked exactly at what they're basing this recommendation on, it's a house of cards. They're not even following their own evidence or their own methods. There's no evidence at all to suggest that it's harmful or beneficial. And if that's the case, my argument always is, if nothing exists, it has to be an I. That's what you say it should be. But I don't know what it will take. It's going to take some kind of collective voice just to kind of keep bugging them and just keep asking them. I don't know what else we can do besides just keep practicing it and bugging them.
We dealt with the same disaster with PSA and prostate cancer screening from the U.S. Preventative Services Task Force in 2012, when they gave it a D rating as well. And as a result, a number of men did not get screened. In fact, 25% of prostate cancers did not get diagnosed on an annualized basis as a result of the change in screening recommendations from the U.S. Preventative Services Task Force. So as a rule, if you think about it, that didn't mean that 25% of prostate cancers went away. They just were being delayed in diagnosis. And so we, as urologists, knew exactly what was going to happen. And the fruit bore out with more metastatic disease, more higher grade disease, more incurable disease. And so they came back with revised recommendations. But it shouldn't ever have to come to that for any disease that we are treating. They should take the educational opportunities from all of us out in the field who care for individuals who are the targets or the victims of these diseases, and try and let us explain what we believe is the best way to help take care of these individuals in the proper way to screen. And I think that the best way to improve our healthcare system is to go from a sick care system to a well care and preventative healthcare system, so that there'll be less sick care down the road and people will have a better quality of life all along the way.
Just to go back to that point, the whole well care thing, I think proactivity might be one of those silver bullets that can help change the system. If we're more proactive with healthcare, which is being like trying to push more preventive services, like what you're talking about, push screening, push conversations with the younger and younger people. Like we should be talking, like with the whole cervix thing too. Like we should be talking about these things to like 10-year-old boys, because that's when they get, the females get the talk about menstruation and stuff. I was in 6th grade when that happened. They took all the girls out of the room. They went down to learn about menstruation, and the boys were left to play like paper football, like on the desks, just until the girls got back. And we're like, where are you going? They were like, we're going to learn about X, Y, Z. And we're like, okay, I guess we'll stay here. And that's just kind of like a microcosm, like what's going on and how guys are approached with healthcare. It's like on the fringes. If we engage guys then about doing whatever, X, Y, and Z, that's proactivity. And I think that could solve a lot of issues where guys are encouraged to go to the doctor. Guys are encouraged to talk about their health, not just physical, but also mental. Maybe you'd see decrease in homicide or decrease in suicides or, decrease in metastatic cancers, maybe because they're going in earlier. I think it's a proactive approach, but we got to start with these younger generations talking,
Sounds like public health to me.
That's why I'm here. That's why we work together.
That's exactly why, because everything you talk about is public health. And we learned about the deficiencies of our public health system when the COVID pandemic hit. Oh. We instantly learned that we don't have an adequate public health system to take care of our nation as a whole. And we're counting on other agencies like CDC or NIH to step in. But it's really public health to really teach people how to actually take care of themselves during a crisis like that for a communicable disease.
It is a hard road to hoe.
It really is.
It's a tough thing.
So I got a question.
Yeah.
I asked you before, what was your personal health challenge? And you said your body image. Why did you say body image? What do you mean by that?
Oh, I still struggle with it. It's been something that's been affecting me for about, what am I, 41 now? I was 6 years old when I became cognizant or I noticed my body. Like I was overweight. After like 5 or 6 years old, I put on a lot of weight. I don't know. I became obese, borderline, not morbidly obese, but I was a pretty big kid. I was pushing 245 at one point, but it affected me from when I was like 6 and 7, just aware of my body. Like I was bigger than other kids. Like I was playing Little League Baseball. I had to get a different size pants than the other kids because none of them fit me. I developed gynecomastia, which was hugely traumatic. I wish people could raise issues about gynecomastia, which is, pretty much like man boobs. Guys have this. And if you're younger and you're going through puberty and you have this, you don't take your shirt off to go swimming. You don't get a shower in front of other people. I had to, and this is, I might maybe getting a bit too much into it, but I had to like use tape to kind of like make my chest look flat. And I was like 14 going through this formative years, this like destroying any kind of self-esteem that I would have. Anyway, I got some corrective surgery when I was a kid, 15 years old, which I'm still thankful to this day to my parents. That changed my life, which was very helpful. But the effects of that from age 6 and 7 up until like maybe I was like 23 when I really lost weight. I was 23 when I got under 200 pounds for the first time in, I don't know, maybe 15 or 10 years or something. I remember like the day where I slept on the scale and said 199. It was like maybe October 2003. I remember like the actual date. It was like so clear to me, but I struggled with that for so long. It still affects me to this day. Like I still like have like these weird thoughts, like these flashbacks. I talked to my wife about it. It was like body dysmorphia at some point. And anyway, so like that's a big struggle. I mean, it's lessening and lessening and lessening, but it will never go away. Like I'm not going to be foolish and think that it will, but it's always going to be there. And so I'm not afraid to talk about it. I know because a lot of guys deal with it, not just for me on my end with the overweight thing. The whole underweight thing is a huge thing for guys. Like they think they're small and weak and feeble and they want to bulk up. So they're doing all this gym stuff and they're not really. Body image is a huge, huge concern. And a lot of guys, I'm talking like high double digits of guys have this issue. They just don't talk about it because they don't even know they have it, but they have it. And it's really effective. It's really effective.
Did this contribute a bit to your suicide moment that you contemplated it?
Oh yeah. You just feel worthless. Like you get to a point where like, for me, like this whole battle, when I started like losing weight, I thought it'd get me into a positive mindset. It got me into very negative raging. Like I was like so pissed about like what I went through and like what the residual effects of that is. It's like an F5 tornado coming through and just blowing away the neighborhood. And like, I'm like left there in the rubble. And I was like so irritated and mad about that my coping mechanism was like rage and cigarettes.
Yeah.
And so
do you still see yourself as overweight?
Yeah. Well, not overweight, but like, I'm like, oh, deal, man, I could really do something better with what's going on. But then like, I got to talk myself. It's just like, it's kind of daily. And it's like something that I learned to live with. It's manageable. It's very much manageable, but I can't lie and say it's not there. It's still there. And I know it will be there. But I use that as a catalyst to educate other men or other males about it. But it's still there daily. It's like a little nagging cough you have or something like that. It's like a little nagging like thorn in your side or like a rock in your shoe. It's like, it's there. You just like learn to live with it though.
So I would assume that when you preach lifestyle versus diet.
Yeah.
You preach overall sense of all the things that create a healthy lifestyle. And you look at these diet plans and you probably get revolted.
It's like I roll my eyes because it's like a short-term fix.
Right.
It's ridiculous. Like they don't solve anything. They just make you worse off. The only thing that got me better is like lifestyle change and the idea of lifelong learning. Like I know this is a lifelong process for me. I always have to work on my temper and rage issues. I still have to work on my body image issues. Like I know that that's hard to get out or get rid of, but I've developed mechanisms that can help me cope with that, to suppress that in healthy ways and just use that as a catalyst to teach instead of just a reactionary thing where, you fall into the cycle of like despondency because you just feed into the whole thing. But I'm not afraid to talk about this stuff either. I think more conversations, again, being proactive. I think that conversations need to be had. I think can really switch that system from a healthcare into a well care system.
Yeah.
It's having conversations like this with the right people.
Yeah. Well, I still remember as a kid, I was so overweight that I'd go into the clothing store and they look at me and they go, "Oh, no, you're going back to the husky section."
Yeah, husky. That was a section, the husky section. Yeah.
Yeah, husky. I couldn't buy clothes in anywhere but the husky
Yeah.
section.
Husky. That was.
And I would tear my pants all the time. You'd bend over and your pants split in the seam in your butt and your underwear comes showing through.
Yeah.
Of course, you wore whitey tighties in those
That's
days.
right.
So,
That's right.
there you are in school and everyone's laughing because your white underwear is poking through and you have to call home to get a new pair of pants. And
Yeah.
these were horrible memories. But,
Are you still affected by it?
oh, I've been overweight my entire life.
But you're not though physically. Like I see you and like you're not. But like mentally, you think you are, right?
Oh, yeah.
That's how I see myself.
What I did is a year ago when I finally went to get a physical, another one, and I was still at 200 pounds. And I'm running every day, biking every day, but I can't change because I didn't change my lifestyle. I did that, what they call that mindless fog stupid eating, where you graze and you consume 2/3 of your calories by eating garbage. And so, but my blood pressure was out of control. And I was pre-diabetic for the first time in my life. And I said, Lutz, you got to change your life. This isn't going to work. You got to change. And so I've dropped 25 pounds.
Good for you. That's awesome.
And all my running, biking, my pre-diabetes is gone. My blood pressure is virtually normal now. But, I know that it's a constant battle. And my biking buddies laugh at me because they know I weigh myself every single day. I don't miss a day on the scale. I watch it like a hawk. And I don't let it fluctuate by more than 1.5 to 2 pounds because that's my mission. And I refuse to ever go back again. And so that's my lifestyle. It's just got to be. It's just got to be part of my life for survival.
That's very powerful stuff. Congrats to you. So I did the whole thing with the weighing though too. But for me, I was weighing myself like 8 times a day. It was like that.
Yeah.
Like it got to the point where I was like, and I remember these days are so in my mind. I was with my wife, Kathy. I think it's before we got married. But I remember I had a scale and I was there. I was in the midst of one of these like little things. Back then it was pretty bad. I'd go in these like cycles. And I remember I was like, I'm going to stop. I took the scale. It was a glass scale. I just went out to the parking lot and just smashed it. And I was like, I never again will buy a scale. For others, it works. Like for you, it worked. For me, that was something for me that actually was making it worse for me. I was just there 8 times a day doing it. And I was like, oh my God. I got to cut the supply off. And so for me, I had to go smash my scale. And I weigh myself maybe 4 times a year. And again, that would be like a half a day for me back in the whole thick of it.
Wow.
I weigh myself like 4 times a year. And I go to Publix here, just like one of those like public scales, like the supermarket. I jump on but that's about it. But that bothers me though, sometimes that I don't have one, but I had to do it so I can kind of cut the blood supply off to not feed it anymore.
Yeah. Michael, once you shared with me that one of your favorite expressions was nil desperandum. And I'm just kind of curious why you believe that is such an important expression for you.
Oh, God.
Why?
When I was a kid, my dad's a pretty cool dude. If you think of any kind of like John Mellencamp song, it's like my dad. Like Jack and Diane, like my mom, my dad. Not really, but it's like I think of that. And he's from simple stock, and he's just a cool dude, like who's like full of life. Got through high school. That was pretty much it. Worked at the same auto mechanic store for 40 some years at the same counter. But he was so full of wisdom. I have a PhD, but I don't give a shit. That guy's smarter than me in so many ways just because of the life skills that he has. And he always told me, and he saw me through the worst of it all. He was always telling me, like, you cannot give up. Do not feed into that. Like, don't despair. You're good. You just have to breathe, bro. You just have to get through this because life sucks and you have to it sucks for everybody. And so part of being a strong person is just learning to acknowledge what's going wrong and just finding a way out and just persisting through it. And I got it tattooed. It was life affirming for me that my dad, who's, my issues are like negligible compared to what he had to go through, like just living, like, but it was really cool. It was from my dad. Dad helped me get through a lot of stuff. It's like a thine rod and thine staff kind of a thing, you know.
Oh, that's a powerful story.
He's a cool dude. He's a really cool guy. Yeah.
Wish I had a chance to meet him.
Yeah, maybe someday I'll take him to Detroit. We can hang out.
That'd be great. You know, my expression actually came from my youth, mens sana in corpore sano. And that was actually the motto from the school I went to. And I used to think when I was a teenager and I saw that, I thought, that's a crappy expression. You know, what value is that? And as you go through life, you go, I get it. Mens sana in corpore sano, a sound mind and a sound body.
I love it.
That's the only way you can live life.
Oh, yeah.
I mean, if you don't have a sound mind, it doesn't matter what your body's doing.
Mm-hmm.
And vice versa. You have to have a sound body in order to have a sound mind.
Yeah, I totally agree.
They're so intertwined, and I am a total agreement with that. And if there's ever a motto that is how I live my life now, that's really it.
That's wonderful.
And I laugh back at the time how I just thought this was a silly expression, but it really is important. So
I love it.
You know, I always like to ask one question, and that's like, how do you want to be remembered? What do you want is your legacy when somebody says, Michael Rovito, the one thing I'll always remember about him, I mean, you remember your dad and you remember that most intimate thought, and you even had it tattooed on you because it was so impactful. But how do you want to be remembered? Not necessarily just to your family, but to your students, your community, the people around you that you've actually served over the years?
I always get the best response from myself. Like I always enjoy getting emails from students where they'd say, or anybody that I work with, hey, what you said to me really resonated and it came true. And I just want to thank you for that, because without that advice, you know, I wouldn't be here. And so I always like that, because I'm like, man, someone's listening. I like to be just remembered as being like relatable, but insightful. It's very modest, but I love being able to have conversation about with anybody and about anything. I love being a conversationalist. I like to relate to people just to kind of see them as a human and just kind of relate on that human level. If people can kind of say, yeah, man, he was a cool guy. He's relatable and things he said were kind of insightful. That would be cool for me, besides being a good father and husband. But
well, I really appreciate you being here.
This is great.
With me and sharing this conversation, having a moment just to talk about our lives, being chubby kids who grew up and can actually celebrate our health and well-being and doing something for the communities around us. And so I just want to say thanks to Dr. Michael Rovito for this really great conversation. And thank you for joining us. I'm Dr. Michael Lutz, urologist and founder of the MIU Men's Health Foundation. Through our events, resources, and this podcast, we are dedicated to men's health advocacy and awareness. We're focused on education, research, and treatment of prostate cancer and men's health-related issues. And for more information about the work that we do and how you can get involved, visit us online at miumenshealthfoundation.org. That's www.miumenshealthfoundation.org. And thank you for joining us.